How do our doctors decide medicine doses for kids? Imagine a busy emergency room where every second counts. When a child needs medicine quickly, doctors have to be very precise about how much to give. They don't just guess. They use a careful process based on facts and guidelines. The main factors they consider are the child's weight and the specific illness or injury. Since children are different from adults, their bodies process medicines differently, so dosing must be carefully calculated to keep them safe and help them recover. The most important factor is the child's weight. Doctors usually measure how much a child weighs in kilograms. They then use this weight to calculate the right dose in milligrams or micrograms per kilogram. For example, if a medication needs to be given at 0.1 milligrams per kilogram, and the child weighs 15 kilograms, the dose would be 0.15 milligrams. This method helps ensure the child gets enough medicine to work without risking overdose. For some emergency drugs like epinephrine, the dose is also based on weight, but there are maximum limits to prevent giving too much. Age is also considered because younger children and infants may have different needs. Their organs are still maturing, which affects how they absorb and process medicines. For example, asthma medications like albuterol are given in different amounts depending on whether the child is under 2 years old or older. Doctors follow age-specific guidelines to decide the right dose. The route of giving the medicine matters too. Whether it is given by mouth, through enrollment 4, or as an injection, the dose can change. For fast action, Roman 4 or inhaled medicines are common in emergencies. Doctors choose the safest and quickest route based on the child's condition and the urgency of the situation. Doctors also relying on trusted guidelines and reference charts from medical organizations. These resources provide recommended doses for many emergency medicines, including maximum limits to avoid toxicity. For example, when treating seizures with diazepam, the dose is 0.2 milligrams per kilogram, but it should not exceed 10 milligrams. For asthma attacks, nebulized albuterol is usually 2.5 milligrams for children under 2 and 5 milligrams for older kids. For croup, dexamethasone is given at 0.6 milligrams per kilogram, with a maximum of 16 milligrams. Sometimes, especially in very urgent situations, doctors estimate the child's weight if it is not known. They might use length-based tools or formulas to get a close estimate. This helps them make quick decisions while still being safe. For medications that need careful control, like drugs for shock, doctors start with a low dose and adjust gradually based on how the child responds and their vital signs. In all cases, safety is the top priority. Maximum dose limits are strictly followed to prevent harm. For very young infants, doses are often more conservative because their organs are still developing. This careful approach ensures that children receive the right amount of medicine during emergencies, whether they are dealing with injuries, infections, or other health issues. So, in summary, doctors decide medicine doses for kids by carefully calculating based on weight, adjusting for age, choosing the best route, and following established guidelines. This process helps ensure that children get safe and effective treatment when they need it most. Always remember, for any medical concern, consulting a healthcare professional is the best step to ensure proper care.